Hello, Mr. Gateway. My name is Dr. Barveld. I'm one of the hospitalists here.
Hi, doctor.
I talked with your nurse from the emergency department, and she gave me a little history of your story, but I want to hear from you what brings you to us today, and also ask you some questions about your medical history. So what's been going on?
Well, I've been having this problem with my mouth and throat with some pain. It's been getting harder for me to eat and to swallow.
And when did this start?
Well, I've had a problem a few years back, but this most recently, it's been about a month or two that, and even the last few weeks, it's been just getting harder and harder for me to open my mouth fully, to eat and swallow. Even swallowing the pills were very difficult. So
you have pain in your throat and also in your mouth?
Yes, the mouth pain. Sometimes my mouth and my tongue really hurt when I'm eating anything, especially if it's, hot or rough, and I really can't open my mouth fully. But otherwise, it's really my neck and throat where most of the pain is.
And when did you say this all started?
Well, I had cancer back 4 years ago when I was 48. I was diagnosed with some throat cancer, and I had treatment for that, and it seemed to get better with the treatment, and I had clean bill of health at the 1 year and 2 year checks, but I haven't been back since then.
Okay. And are you having any pain elsewhere, or?
No, it's mostly just in the mouth when I'm eating or swallowing, and then the throat, it's always hurting in the throat. And then sometimes I get some sharp shooting pains down into my neck and shoulder, but it's really just mostly the throbbing in the throat that bothers me the most.
Okay. And on a scale from 0 to 10, if 10 is the worst pain you can imagine, what number would you give the pain in your throat right now?
I'd say it's probably 7. It's very strong.
Does it get higher than that?
Oh yeah, it goes off the charts when I try to eat something.
Okay. And what medications do you take for pain?
Well, about a month ago, my main doctor gave me 180 Percocet and told me to take 1 or 2 of them when I had the pain. But I ran out of those about a week ago. It was getting harder and harder for me to swallow them anyway.
Okay. And then any other medications that you're taking for the pain?
No, not for the pain. It's just haven't had anything. The pain's really getting worse and worse.
And besides swallowing, does anything else make the pain worse? And what makes it better?
Just swallowing, even just to clear my throat or to talk too much, that makes it worse. And about the only thing that I've found besides the medicine that makes it better is if I take some cold water, if I get some ice cold water, hold it in my mouth and sort of swallow it slowly, that eases the discomfort.
Okay. Have you been losing weight with all of this?
I think I lost about 10 pounds, just not eating.
Well, I'm sure you must be a little scared with all of this going on. I know that you've had the cancer diagnosis before.
Yeah, that's a big worry, and then I notice when I'm brushing my teeth that my gums bleed, and I'm not sure if I have a cracked filling or something, but I need to see a dentist and I need to see a doctor because I'm really worried about these things. Okay,
well, we'll definitely touch base with all of your doctors. I want to ask you a couple more things about your cancer and then about your medical history in general. So your cancer was diagnosed 4 years ago, you said, and what treatment did you have for your cancer?
Well, they cut out what they could of the tumors, and they gave me radiation and chemotherapy, and they told me that they got it all, and that we're hopeful that I'd do well with that.
Okay. And do you have any other medical problems at all?
Well, I still smoke. I've been smoking for 25 years, about a pack a day, and sometimes I get short of breath, and I was told I get emphysema, and I take an inhaler for that when it gets bad.
Okay. Are you still drinking too? I read somewhere that you were drinking a little more heavily.
I used to drink a lot, a bottle of vodka a day, but 6 months ago I decided I'm going clean. I went with AA, and I haven't touched the bottle or any alcohol really since then.
Okay, great. And any other surgeries besides the throat surgery you've had?
I work construction, and I busted up my leg once and needed surgery with some pins in that, but other than that, nothing really.
Okay, and any medications besides the Percocet that you were prescribed?
Just the inhaler that I need, but no, nothing else that I've been prescribed.
Okay. And what allergies to medications do you have?
Well, codeine, makes me sick to the stomach, and I got a rash with some ampicillin, but those have been the only problems that I've had.
Okay, excellent. And then now some about your family history. Are any cancer in the family? Any medical problems in your family I should know about?
No cancer. My father was an alcoholic, and he died young. I don't know what he died of. My mother also died young. She had a heart attack, is what they said, but she was a very nervous woman, and I'm not sure about that. I have a brother and a sister. I haven't seen them in ages, but last I knew they were fine.
Okay, and are you living with anyone?
No, I got divorced several years ago, and my wife lives with my 17-year-old son.
Okay, and how about working? Are you able to work?
No, I've been working construction, and then when this cancer hit and all the treatments that I needed, I haven't been able to work, so I've been on disability since then.
Okay, these have been some hard years. Has anyone been helping you to cope with any of this, or have you seen anyone to help you?
There was one time when I talked to someone, because after my divorce I got really depressed, and I even thought about killing myself at one point, and so they made me go see this doctor, and but I got better after that.
Okay, are you depressed right now, or?
Well, lately I've been getting depressed. I haven't been sleeping, and I haven't been eating, and I don't know if it's more being really depressed or more just really being very scared that about this cancer, and could it be that, or what else is going on?
Yeah, I'm sure. You haven't had any thoughts of hurting yourself or anything?
No.
Okay, good. And any other substances? You say you're smoking, you stopped drinking, anything else that you're taking that's not prescribed to you?
Well, back in my wild days, I used to snort cocaine, but I haven't done that in ages. But I do find that sometimes smoking pot really helps sort of ease my nerves and help me to get some sleep. So I do that occasionally.
Okay, well, thank you for being open and honest with me about all of your medical history. Is there anything else that you think I should know? Any other pains you're having, any side effects from medications, any other symptoms that you think are concerning?
The only other thing is I have a little constipation, but I don't know if that's because I'm not eating or drinking. But other than that, I'm just with the things that we had talked about.
Okay, great. Well, thank you, Mr. Gateway. Why don't we go ahead and examine you?